Hello everyone! In this video, we will be talking about diabetes and how to address it in order to prevent dementia. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem-solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. Did you know that having diabetes puts you at a greater risk for dementia? More than 3 million Canadians are living with diabetes, which is when your body has problems using or making insulin. Insulin is made in our pancreas and helps our body transform sugar into energy. If the pancreas is not producing enough insulin, then people will get type 1 diabetes because their body has trouble with transforming the sugar into energy, which results in high levels of sugar within their bloodstream. Not having enough insulin creates type 1 diabetes. This type commonly occurs at a young age, but no more than 1 in 10 people with diabetes have type 1 diabetes. Over 90% of people with diabetes have type 2 diabetes. This is when the body is producing insulin but has developed insulin resistance, so that not enough sugar in the blood is getting converted into energy. Type 2 diabetes is generally preventable and develops over time because of an unhealthy diet and lifestyle. Being overweight increases the chances of getting type 2 diabetes. Getting type 2 diabetes is like going on a journey. People start off with a normal, functional body where insulin works well and blood sugar is easily converted into energy. As they age, their insulin becomes less efficient in converting blood sugar into energy, so the level of sugar in their blood rises. For some people, levels of blood sugar get so high that the person is diagnosed with diabetes. Some people have pre-diabetes. This means that they have high blood sugar, but the levels are not high enough to be diagnosed as having diabetes. Being diagnosed with pre-diabetes is an important warning bell. When someone has rising sugar levels, it is important to make lifestyle changes to avoid developing type 2 diabetes. The final type of diabetes is called gestational diabetes. This is diabetes that happens during pregnancy, and between 6 to 9% of women will develop it when pregnant. Someone who has had gestational diabetes is at greater risk of developing type 2 diabetes later in life. The signs and symptoms of diabetes and prediabetes may include the following: frequent urination, excessive hunger or thirst, feeling very tired, having blurred vision, numb or tingling sensation in hands or feet, dry skin, having sores that are taking longer than normal to heal, having more infections than you normally do. If you're experiencing any of the symptoms I just mentioned, it is possible that you might have diabetes or pre-diabetes. If you're concerned, consult with your doctor and let them know that you would like to be checked for diabetes. Now that we have discussed the symptoms, how can we reduce the risk of developing diabetes? The first way to reduce your risk of getting diabetes is by making lifestyle changes. For example, it is important to have an active lifestyle and to exercise at least 3 times per week. Being physically active decreases your risk of developing diabetes. The next step would be to obtain or maintain a healthy weight. Being overweight or obese is a big risk factor for diabetes. Eating healthy foods and avoiding excess sugar, especially sugary beverages, is also important. Lastly, getting yearly checkups and attending medical visits is an effective way to stay informed about the status of your health. All of these lifestyle changes are great ways to prevent diabetes. However, there are some risk factors of diabetes that we cannot control. The first risk factor is age. About 3 in 10 people aged 65 and older have diabetes, compared to only 1 in 100 among those aged 18 to 34. Genetics also play an important role. Having a family history of type 2 diabetes or being a woman who had gestational diabetes during pregnancy can also increase the risk of getting diabetes at some point in life. Additionally, your race or ethnicity can also increase your risk for diabetes. For example, diabetes tends to be more common among those of Indigenous, Black, South Asian, or Hispanic descent compared to their white peers. Now that we know about diabetes, its symptoms and risk factors, let's talk about how diabetes is related to dementia and Alzheimer's disease. Dementia is a general term for cognitive decline, while Alzheimer's is a specific disease. Alzheimer's is the most common type of dementia. Older adults who have diabetes have a 50% greater risk of getting dementia compared to older adults without diabetes. Diabetes increases the risk of developing Alzheimer's disease and other types of dementia, such as vascular dementia. Being pre-diabetic can also increase the risk of developing dementia and Alzheimer's disease. There are some strategies that will help you have a healthier lifestyle to manage or prevent diabetes. Talk to your doctor about measuring your blood sugar, especially if you are experiencing some of the risk factors we mentioned previously. You can also talk to your doctor about how you can manage your symptoms if you do not have diabetes or prediabetes. If you do have diabetes or prediabetes, be sure to regularly check your blood sugar so you are aware of your levels and are able to keep your blood sugar controlled. Also, keeping a healthy diet, such as limiting sugary foods and drinks, such as soda or desserts, is an effective way to prevent diabetes. You can also work towards keeping a healthy weight. If you are overweight or obese, you can work with your doctor on a plan to lose weight. Regularly exercising has many positive benefits for your health and well-being, and can also help you to manage diabetes or reduce your risk of developing it.